Now let's talk about weight loss surgery and incisionless weight loss options. There are two basic categories of weight loss surgeries. These are restrictive and malabsorptive procedures. Restrictive procedures are the simpler of the two. In a restrictive procedure, we simply restrict or reduce the size of the stomach so that a patient gets full on smaller portions. This category includes gastric banding and gastric sleeve. Because these procedures are technically simpler, they carry a lower risk and can sometimes be offered to patients with a BMI as low as 30. In a malabsorptive procedure, some of the small intestine gets bypassed, which prevents you from absorbing all of the calories you consume. This category includes the duodenal switch, SIPS, and gastric bypass. Since malabsorptive procedures are technically more complex, they are typically only offered to patients with a BMI over 35. First, let's cover the gastric band or lap band. A gastric band is the only adjustable weight loss surgery, and also the only one that is easily reversible. Gastric bands are placed around the top part of the stomach, and can be adjusted through a small access port that's beneath the skin. If the band is tightened, this causes the top part of the stomach to fill up first. When the top of the stomach is full, your brain perceives a similar sense of fullness as if your entire stomach were full. This helps to reduce portion sizes when eating healthy foods. The advantages of gastric banding are several, including the fact that bands have the lowest short-term risk of all weight loss surgeries, and they are adjustable and reversible. Also, gastric band patients have the shortest facility stay, and the fastest overall recovery as well. Band patients don't have to take as many vitamins as sleeve, bypass, and SIPS patients. And lastly, for those who don't have insurance coverage for weight loss surgery, it's the most economical option. On the downside, weight loss is much slower with a gastric band than with the other procedures. Also, some patients will lose less weight overall than the other surgeries, as it is a slightly less powerful option. For this reason, we do not recommend it for a patient with a BMI over 45. Lastly, the band is a foreign body, which opens up some longer-term risks. As far as potential complications of gastric banding, there are a few to discuss. Slippage of the band is the most common complication. This occurs in 1 to 2% of patients and can require surgical revision or removal of the device. Band erosion is less common but more serious. During an erosion, the band wears a hole in the side wall of the stomach, and part of the band ends up being on the inside of the stomach. Band erosions occur in less than 1% of patients, and always requires removal of the device. Problems with the port or tubing, such as a crack or a leak, can occur, and would require surgery to correct as well. The risk of death from a gastric band is extremely low at around 0.05%, or 1 in 2,000. A gastric band procedure takes about 40 minutes to perform, and patients can be headed home in as little as an hour after surgery. Patients with a non-physical job can usually be back to work in less than a week. As far as post-op diet, band patients are required to do 24 hours of clear liquids after surgery, followed by 14 days of pureed food, and then solids. Lastly, it's critical for band patients to come in monthly for the entire first year after surgery. After the first year, we recommend an office visit at least once a year to check the band position with an X-ray. Next, let's talk about the gastric sleeve, which is the most common weight loss surgery in the United States. It's been around for about 15 years as a standalone procedure. A gastric sleeve was originally a part of the duodenal switch procedure, which we will cover later. However, it's been done as a standalone procedure, with some modifications to the original technique, since around 2005. In a gastric sleeve, a narrow tube is made out of the stomach, and the remaining part, seen on the right side in the diagram, is removed. In this procedure, no intestine gets bypassed, so patients still absorb all the calories they consume. Because of the new smaller stomach, however, they will take in far fewer calories after surgery, as sleeve patients get full on very small portions. Advantages of the sleeve include much better hunger control, as compared to a gastric band, and fewer food intolerances, which typically leads to better weight loss. Unlike gastric bypass and SIPs, having no bypassed intestine significantly reduces the long-term risk of things such as malnutrition and vitamin deficiencies, and also there is no implantable device. The overall risk of a sleeve is lower than for bypass and SIPs, yet the results are fairly similar. And lastly, the long-term office follow-up regimen is not as intense. On the downside, it is overall a newer procedure, so we don't have 50 years of data on the sleeve, like we do with gastric bypass. Also, GERD, or acid reflux, can sometimes worsen after the sleeve. And lastly, this procedure is not adjustable, and it is not reversible. There are a few potential complications of gastric sleeve. Staple line leakage can occur in about 0.5% of patients. This relates to the tiny titanium staples that are used to seal off the stomach. This risk can be significantly higher in revision patients, such as band to sleeve conversions. Postoperative bleeding is also a potential complication that occurs in about 0.5% of patients as well. Obstruction of the gastric tube is an uncommon, but possible issue, that relates to either a kink in the sleeve, scar tissue, or swelling. This can require endoscopic or surgical procedures to correct. The risk of death from a gastric sleeve is pretty low at around 0.1%, or 1 in 1,000, which is about the same as for gallbladder removal. A gastric sleeve surgery usually takes less than an hour to perform, and is either an outpatient or overnight stay, depending on a patient's medical issues. The diet advancement is somewhat similar to what we saw for gastric banding, however clear liquids are required for 7 days, pureed food for 21 days, and then solids. Back to work is around 7 to 14 days for desk jobs, or 3 to 4 weeks for physical jobs. Lastly, office follow-up visits are recommended monthly for the first year after surgery. So that about does it for restrictive procedures. Next, let's talk about incisionless weight loss options. Gastric balloons are a newer option for patients who need to lose weight but wish to avoid surgery. There are various balloons already available and some in development, so please refer to our website for current specifics. Firstly, it's important to point out that balloons are not covered by any insurance at this point in time. So one of the main advantages of this procedure, if you are a self-pay patient, is that it's roughly half the cost of a surgical procedure. Another advantage is that, even though laparoscopic weight loss surgery has a very low risk, a gastric balloon has even less risk. Balloons are also reversible, which some may see as an advantage, as we are not permanently altering the anatomy. However, others may consider it a disadvantage. On the downside, weight loss is somewhat limited with a gastric balloon and rarely exceeds 50 pounds. In some patients, weight loss can even be minimal, if the recommended diet and exercise protocol is not strictly followed. Nausea and vomiting can be a major issue for some balloon patients, which can at times require early removal of the balloon. This complication is known as balloon intolerance. And lastly, since the balloon must be removed after 6 to 8 months, it is much harder to maintain weight loss than with a permanent surgical procedure. Lastly, let's talk about combination therapy, which involves using medications to augment the success of patients who choose a surgical or incisionless option. Our practice has a unique and extensive history with powerful prescription appetite suppressants that can be utilized alongside any of the aforementioned procedures. Obesity in some ways is like cancer, which can be relentless and recurrent. Many cancers require treatment with medications in addition to surgery, and our practice has an experienced team in this realm which can keep you on the pathway of success.